Dr. Hanner. I'm with the Verber Family Dentistry, part of the Verber Dental Group. Today I'm going to explain just a typical orthodontic consult with our patients. So when we see a patient, a lot of times it could be through a hygiene appointment, or it could be just with a new patient that is interested in Invisalign treatment. We bring them in for an initial consult. At that consult, we'll do a scan of your teeth as well as take photos of the teeth. Both of these are needed for the full Invisalign treatment plan then ultimately when we decide how to move your teeth. This is an example of how we can take a look at where your teeth start and where your teeth could end with everything. This scanner in particular, we can look at all different angles, from the top teeth to the bottom teeth, as well as from side perspective, on both sides, all around. So this helps to give patients a nice idea of where and how teeth can be moved around for treatment. It's a computer simulation, so it's not accurate 100%, but at least gives patients an idea of what we can do. After we go through all of this, we then kind of talk about the process of Invisalign, what and how long something like this could take, how many trays, what is involved with all of the trays. We talk about how to clean, how to take care of all of your trays, and then also just kind of what's involved with that first appointment when we do give the Invisalign treatment to you. Our assistants here are very well educated. A lot of them are actually going through Invisalign themselves, so they're able to really walk through with a patient how to clean your trays, what to do, what to expect, and kind of how to maintain things along the way. We then also will be able to look at if you are a patient that has dental insurance to kind of see what kind of coverage there is and to formulate a finalized treatment plan at that appointment so that we can determine if we are going to move forward with treatment. Otherwise, pretty straightforward. The consult itself is of no charge. It is something that we do just like talking to patients about. So if it is something that would be interested in, I do encourage patients to at least educate themselves about the topic, and then a decision could be made from there. Invisalign treatment, if you do decide you want to do it, by the time we decide and want to move forward, it does take, we usually schedule about 3 weeks out, and then have patients come back to deliver the Invisalign treatment. I try to get patients back probably initially every like 5 or 6 weeks just to kind of see how things are moving. Every provider is very different with that. Some may not have to see them as often, but Invisalign itself is a very patient-driven process, so compliance is a huge factor, making sure trays are being worn a majority of the time with everything. So I do like to check in and just see how things are moving, as well as just if patients have questions, just to check and see how things are going along the way.